For years, residents near Boston's Logan Airport have complained that aircraft emissions are making them sick. Now, a state commission report has concluded that such fears cannot be dismissed out of hand. It finds that people living near Logan do suffer higher rates of respiratory problems. But whether that's directly linked to the airport is still unclear. When researchers looked at neighborhoods with high exposure to Logan Airport, children were almost 4 times more likely to have undiagnosed asthma. That's one of the findings from the Department of Public Health's multi-year survey. But the survey could not directly link the asthma rates to Logan. Regardless, says Massport CEO Thomas Glynn, much has changed since 2005 when the survey data was collected.
We started working on lowering emissions with the airlines, with the airplanes, and with the trucks, the cars, and the buses that service the airport campus. So we've made some good progress since 2005.
Another change is fewer flights today, meaning less jet exhaust. At the same time, the study found no higher rates of heart disease or hearing loss. But noise is still an issue for Jerome Falbo, who lives in neighboring Winthrop and serves on a town committee focused on airport hazards.
The study de-emphasized, to me, the effect of noise and air pollution on the people who live at the perimeter of Logan Airport.
And while Massport plans to work with the state and local health centers on preventive care in neighboring areas, Thomas Glynn admits challenges still lay ahead.
We want to work with all the existing healthcare institutions, the hospitals, the doctors, and the health centers, and the city, the Boston Public Health Commission and the state DPH. So that's always a challenge, just to get everybody to kind of, assemble and kind of work together.
Here to help us delve deeper into the report is WGBH science editor Heather Goldstone. So what's your takeaway from this? The report is almost 10 years old. Clearly, a number of things have changed. Those neighborhoods are still very dense, and there are socioeconomic differences there than there are in outer communities. What is your assessment?
Well, I think, first of all those things you're talking about just highlight how complex it is to try to boil something like asthma rates in a particular community and point the finger at one particular source. But if anything, I would say that this study to me was surprising in that I expected actually that the health effects would be worse. That's not to say that there aren't any, but certainly I was surprised to see how few they were able to find.
So they looked at communities that were also surrounding Logan too. So give us a perspective of what they found versus that concentrated area.
Well, so what they did, they were tasked with looking at health impacts in the 17 communities within a 5-mile radius of the airport. And rather than just saying, okay, well, you're 300 feet from it, you're 3 miles from it, and just using distance as a proxy for potential causes of health problems, they said, well, we think the 2 causes would be either air pollution or noise. And so they looked very specifically at those and actually developed, in the case of air pollution, a model based on this 2005 data about emissions of particulate matter and certain gases like nitrous oxide and carbon monoxide. And then they used that to create a map, which you can see here, where they actually put 3 categories: high, medium, or low exposure to these air pollutions. They modeled how far the air pollution would actually move based on the wind and other information. And so they then put these boundaries on what would be the high exposure, the medium exposure, and the low exposure. And what they found was that in most cases, there's no significant difference between those 3 areas in the health problems, but with the 2 in specific, children with undiagnosed asthma, there's a 3 to 4 time higher rate of undiagnosed asthma in children in that high exposure area, and also a higher rate of respiratory problems in adults.
Okay, so we already know that kids in urban settings have a higher rate of asthma. What has it got to do with being near Logan? Well,
so they also went to real pains to try to narrow down all of the different things that could go into this. So they tried ruling out a huge suite of demographic factors: age, ethnicity, gender, obesity, poverty, alcohol use, smoking, factored all of those things in. They also noted that within that high exposure area, in addition to the airport, homes tend to be closer to major roadways. And so they tried to rule that out as another source of some of these sources of air pollution that could do it. And in doing so, I mean, it changes the statistics definitely when they just looked at, do people here have a problem or not? And then when they weighed in all these other factors, it hopefully clarifies things a little bit. And in the end, what they found is that the air pollution from Logan is probably in most cases less than 1% of the air pollution that people are being exposed to. And that
in that area.
In that area. Well, and throughout. In fact, asthma rates in the whole study area were elevated above the state average, not just in that high exposure area. So it seems more like it's a straw that broke the camel's back situation.
I'm also interested in what they didn't find, that there was no increased incidence of heart disease. And I was interested that they didn't focus on noise pollution, which was a huge ordeal when I first got here in the early 80s. That was just noise abatement, noise abatement, noise abatement. But I don't think the noise has really been abated, has it?
Well, I mean, they note that there are fewer flights and that they've tried to work on that. Certainly noise is still an issue for some people. You can only find what you look for. And in this case, what they looked for relative to noise was only hearing loss. And they didn't find that the noise levels were significant to cause significantly enough to cause hearing loss. But it's interesting, there was a study last fall conducted by researchers at Harvard that looked at 89 airports across the country and found that noise can actually be associated with cardiovascular symptoms in older adults. We also know it's associated with annoyance, with stress, with sleep disruption. And those were not things that were really looked at in this study.
I know. I think about those people every time I fly over, thinking, I'm glad that's not my house. All right. Heather Goldstone, thanks so much for that, as always. All right. Well, there were some fireworks yesterday between an attorney representing accused murderer Aaron Hernandez and the judge hearing the case. And it all centered on the presence of the media in the courtroom.
I object to the court giving the Commonwealth an opportunity to make a speech describing what they claim is the evidence elicited by the grand jury to play to the assembled media.
I could not envision a proceeding where the press would not be invited to attend. We do not operate behind closed doors.
That feisty meeting tomorrow, the role of the media in the courtroom tomorrow on Beat the Press.